Today I'm going to be talking about eyelid surgery. So as we know, there are two eyelids, upper and lower. When we think about upper eyelid surgery, we always should think with the eyebrow, because sometimes the main problem is not just the upper eyelid, but the brow descent. So the main goal is to restore the youthness of the eyelid area. To restore the upper eyelid area, generally we need to do upper eyelid surgery as well as brow lift surgery. Then we can get the best harmony. But in patients with an ideal eyebrow position, only an upper eyelid surgery is possible. So when we evaluate upper eyelid, as I told, we evaluate it with the eyebrow. And in the same manner, when we evaluate the lower eyelid, we need to combine it with mid-facelift. However, sometimes lower eyelid surgery is enough. Generally, the lower eyelid problem is with the mid-face hypoplasia or atrophy. In those cases, we may need to do fat injection or a mid-facelift to restore a better eyelid positioning. The problems in the lower eyelid is excess skin or long lower lid distance. To correct these, we can do a lower eyelid blepharoplasty, and sometimes we may need to do a mid-facelift, because the main problem is sometimes not just lower eyelid, but also mid-face descent. When we lift the mid-face, we can restore lower eyelid together. And we can combine eyelid surgeries with cat eye surgery as well. So when we do a brow lift, temporal brow lift, upper eyelid surgery, and contapexy, we can give an appearance of a cat. So it's called a cat eye surgery. When we do an upper eyelid blepharoplasty, we position the incision in the fold, upper eyelid fold, so that the incision cannot be visible. What's more, we can do a temporal lift or brow lift to give the harmony of the upper eyelid. When we do a lower eyelid surgery, we have two options. We can either use an incision just under the eyelash so that the incision won't be visible, or we can do an incision in the eyelid, which is completely invisible, to reduce the volume of the eye bags. The recommended length of stay after upper blepharoplasty or lower blepharoplasty is around 2 days. We advise patients not to use any blood thinners, including vitamins, which may increase the bruises, and also stop smoking for faster healing. We generally advise our patients to have shower 1 or 2 days after the surgery.